I just appreciate the kind words. I'm humbled that we recognize at this podium in your honorable presence. You are so wonderful. You gave your time. You let your other things go. You're here. You're here for an incredible cause, very rarely mentioned in the history of female life from the time of Bible. So, the overall blame the victim issues, this and that, it's only in the modern times women have find voice and they are bringing their issues, their equality issues. With equality issues, there is desire to have a family, desire to have a happy, healthy, abundantly well-deserved life for them. And endometriosis patients, unfortunately, are not happy because they may suffer from these issues. So I am lucky here to speak for them and to start something with Padma. I'm more lucky, right in front, Lena is here. She's also lending her beautiful persona, which is a representation of the new generations to come. They will see things differently. I realize that I'm already past 60. I see things differently. Many times my daughters, who are also St. Anne's graduates, they're tough cookies, you know. Their algorithm is different. So, but yet I have a communication with them when it comes to those issues. So we're happy Lena is here, and I'm sure the world will change more hearing the voices of this community. To cut it short, it's a women's health issue. This disease affects 10% of women, that's for sure. And it causes significant fertility issues, number one, pelvic pain issues in women. And many of those patients, majority of the patients who have hysterectomy do end up getting due to this disease. Let me make it very fast for you. Unfortunately, these women do get multiple surgeries, improper, incomplete procedures, and they continue to suffer. So this year's medical conference, I've been doing medical conference to educate doctors on this. I'm happy to join many of them in this podium. They're very respectable individual surgeons. Our goal this year, I named the conference name as Pursuing Precision Through Passion. I put the weight on the surgeons, doing the good work on the patients. Compassion is not enough. The lesions of these tissues have to be removed, and this disease is, I don't want to scare you, but it is not an easy surgery. Today, many GYN oncologists, they are the cancer surgeons, all of them have admitted that endometriosis patients are the last patient they want to see. It's very difficult to achieve good results. You have to be committed with passion. I am joined with my mentor, Harry Rich here, who have taught me many of the surgical techniques from 1980s. I'm joined with many of the faculty here. And basically, we will have to work a lot. We started something it's a revolution, I believe. There are more endo articles coming. The press is covering this. More women know about this, and they come up and they get the right help. So, thank you for coming. I want to introduce my colleague, who also is an endometriosis person, specialist, but he's an oncologist who really appreciated the role of endometriosis in ovarian cancer. Ladies and gentlemen, I'm sorry to tell you, but endometriosis is a precursor of ovarian cancer, and women who get ovarian cancer under the age of 50, there are 2 to 3 times more if they have endometriosis. One more thing, as you know, there's a Harvard study just came out. Women who have coronary heart disease, there are endometriosis patients have 2 to 3 times more coronary heart issues than other people. So this disease doesn't involve in pelvis, vagina. It's a systemic disease, involves everywhere. to cut it short, thank you. I'm very honored to call Dr. Far Nejat here. Far Nejat is a GYN oncologist, minimally invasive surgeon, and he's well known throughout the world with his work with cancer and published multiple articles. He's the first guy to bring the endometriosis and ovarian cancer in a way, persistently pushing that the association is there and regular doctors pay attention for it. Here's camera. Far. And I like to actually give him the award so we could move on. One second. This is Harry Rich Award for pioneering work in the science and treatment of endometriosis, Far Nejat, in 8th Annual Blossom Bowl. Far, thank you for your good work. Say a couple of words very shortly. Okay?